Welcome everyone to the channel. Today we will discuss about TAMIS for rectal polyps. A 55-year-old gentleman presented with rectal bleeding. Colonoscopy showed a 2 cm polyp 6 cm from the anal verge. TAMIS was planned. The biopsy was tubular-villous adenoma with low-grade dysplasia, so only a polypectomy was planned at submucosal level. These are the components of the gel port. You can see the access channel with the introducer, the gel cap seal, and self-sustaining sleeves with the bag where the CO2 inflation will be maintained. The self-sustaining seals are inserted through the gel cap slowly. If you insert too much, it will come out this way, so you pull out very carefully. This gives a tight air seal. You insert 3 self-sustaining sleeves in the gel port, 1, 2 and 3 ergonomically. The access channel is introduced and fixed. The gel cap seal is fixed over the access channel. You can see the outlet for the gas, 3 ports, one through which you can insert the gas chamber and the camera, and other routine laparoscopic instruments are inserted through the other channels. The screen is kept at the head end of the patient. The surgeon operates from the other side. The 2 cm polyp is seen. A margin of 5 cm is given. We are using a cautery hook. The growth is at 6 o'clock position, as you can see. As the hook dissection is becoming more smoky, we resorted to trying other instruments as well, like spatula. The dissection is continued at the submucosal level. This is the lateral aspect of the tumor where you push and another 5 mm margin is taken the other side. Care must be taken not to fragment the specimen. The fragmentation rate of 5 to 10% is seen in studies. Take care to either push the polyp or hold it from any of the margin of the cut end so as not to fracture the polyp. So we use a spatula here again. Now since the spatula also getting smoky, we decided to use ligashua. Harmonic. Complete dissection from the base was done without any fragmentation, and then a split rectoscope was introduced to arrest any bleeding and examine. This is the final specimen, which shows tubular-villous adenoma with low-grade dysplasia. Margins showed normal mucosa, and after 18 months of follow-up, there was no recurrence. Thank you.